Well, this month is American Heart Month, a special month dedicated to raising awareness about cardiovascular disease, which is the #1 killer of women. And on Valentine's Day, it's only appropriate that we talk about matters of the heart. The facts are concerning. Women, especially Black and Hispanic women, are disproportionately impacted by heart disease and stroke. Research shows that heart attacks are on the rise in younger women, and cardiovascular disease is the #1 killer of new moms. So with us today, we have Dr. Rachel Haley, board-certified family medicine with HCA Midwest Health, here to discuss with us the facts and how you can take care of your heart health for life. Dr. Haley, thanks so much for being with us today on this Valentine's Day too. And of course, we do want to let people know what they need to be thinking about when it comes to protecting themselves against cardiovascular disease and maintaining their heart health too.
Grace, it's important to know that once you develop cardiovascular disease, you can't make it go away. We can manage it with advanced technology, procedures, and medication, but we can't cure it. And as you mentioned, heart disease is the #1 killer of women in the United States. So it's important for everyone, especially women, to understand their heart.
Yeah, especially given the fact that we can't cure it. I mean, definitely one of those things you want to make sure you're taking care of. What are some of those typical symptoms when it comes to a heart attack?
That's a great question. So classic signs of a heart attack include a feeling of pressure or pain, squeezing, fullness in the chest. That pain can go to the neck, the jaw, the back, the stomach. You can have shortness of breath, lightheadedness, even nausea, vomiting, and indigestion. But those factors can differ vastly between men and women, and that's why it's often missed in women. Women can have a few symptoms of the classic signs, or they can have none at all. One of the frequently overlooked symptoms is fatigue, and let's face it, yeah, exactly. Women every day think that's just a normal part of their busy lives, and for that reason, we are missing heart attacks.
Yeah, it's so interesting that the symptoms differ between men and women. And of course, we do hear a lot about how COVID has impacted heart health over the past several months with this virus. What's the update on that situation?
Well, it's true. People who have been infected with COVID can experience decreases in heart rate, shortness of breath that can last months after being infected. It can cause inflammation of the heart, which can weaken the muscle and lead to heart failure and arrhythmias, where your heart doesn't beat correctly. So these are very concerning and obviously being studied and researched right now.
Yeah, obviously a very hot topic right now. So let's talk about prevention then. What can women sitting at home right now do on their journey today to make their heart a little healthier?
Well, first and foremost, don't smoke. And if you do, work towards quitting. Also, eat a healthy diet. I've seen so many patients' diets slip into unhealthy territory over the past 2 years of the pandemic.
Not too surprising.
Yeah. So a diet, full of fruits and vegetables and, lean protein, like the Mediterranean diet, that's recommended. And it's also important to maintain a healthy body weight and be physically active. The American College of Cardiology recommends at least 30 minutes a day of heart rate raising activity, and that's at least 5 days a week. So look for ways to turn off the TV, get off the couch, go for a walk, a bike ride, lift some weights, or do yoga.
Which, as long as you are able to schedule that into your day, it's certainly one of those things that's pretty easy to achieve.
Yes.
So is there anything else you want to add on this topic before we let you go?
Well, I think it's important to, know your family history. That's key. Talk to your doctor if there is a history of heart concerns, whether it's stroke or, heart attack. Also know your numbers, whether it's your cholesterol, your blood pressure, your weight, diabetes. Those are things that you can use to determine if you're at risk for heart disease.
Perfect. Dr. Haley, thanks so much for educating us on the topic and helping keep us safe and healthy as always.
You're welcome.
And of course, for more information, you can head over to hcamidwest.com. There you can also find a doctor as well as the closest ER and urgent care near you.